Hello everyone, today's video is about topical insulin eye drops. We will be going over a short case study of a patient I treated recently as well as how to prepare these eye drops. So let us begin. A 65-year-old gentleman, a long-term diabetic, presented to us after being treated for infectious keratitis elsewhere over the past 6 months with a bunch of cocktail medications. So he had a 7 by 6 mm epithelial defect, as you can see here, with rolled edges and raised margins. All prior medications were stopped and only lubricants were started on this visit. When he followed up with us after a couple of days, we noted an inflammatory hypopyon had begun to form. At this point, we thought it prudent to start topical insulin eye drops, as we were suspecting a neurotrophic keratopathy from the beginning. Subsequent visits showed that the epithelial defect had improved, patient felt better, but the hypopyon was worsening. At this point, we took the decision to start topical steroids under close observation at a low dosage. We did not stop topical insulin. And on the subsequent visits, the defect improved further, the hypopyon reduced, and we gradually tapered the topical steroids over the next 1 month. He was on regular follow-up with us, especially close follow-ups during the use of topical steroids. So the hypopyon had disappeared and the epithelial defect was gradually reducing in size, as you can see in these pictures. It's important to remember that topical steroids are used extremely rarely in neurotrophic keratitis, but only in conditions where there is an inflammatory hypopyon. So topical insulin was continued for a total of 2 months. As you can see here, the epithelial defect kept reducing further and further and further. And the clinical picture on the last visit revealed a healed epithelial defect with no hypopyon. The eye was quiet and the patient was quite comfortable. So this is a split screen showing the initial presentation and the final presentation of the patient. You can see that the epithelial defect has healed well and the hypopyon has regressed completely. The cobalt blue filter shows the initial size of the epithelial defect and the healed defect at the end, again showing an excellent response to the use of topical insulin eye drops. So this case emphasizes that topical insulin can be an excellent option for patients with neurotrophic keratopathy. So now we will quickly discuss 3 important things. First, what are the indications of topical insulin eye drops? Second, how do we prepare it? And third, what are the pros and cons of using it in conditions like the one just discussed? So the commonest indication for topical insulin eye drops is neurotrophic keratopathy. Other than this, it can be used in any case of persistent epithelial defects. It has also been used in severe dry eye patients. How do we prepare it? It is very easily available in the market. You just need to buy a vial of human actrapid insulin, or what we also call as soluble insulin, and this will have a concentration of 40 international units per ml. So we take 4 ml of this, which is equivalent to 160 international units. We add this to 6 ml of distilled water, which ends up with a concentration of 16 international units per ml. This is my preferred concentration and it has worked well for me in my experience. So concentrations of topical insulin vary in literature. So from as low as 0.5 to as high as 25 IU per ml concentrations have been cited, and there is a lot of variability in the doses in literature if you go through it. I prefer to use the 16 unit per ml concentration because it has worked well for me. The pros of using topical insulin is that it accelerates corneal healing. The therapy is non-invasive, it is safe and well tolerated, and it's a very cost-effective modality of treatment. The cons are that it requires refrigeration, and also another con is that it takes a while to have its effect. It may take a couple of months, as seen in this patient. So that was all for today. Thank you for your time. These are my contact details. Please feel free to mail me or WhatsApp me for any doubts, and this is where I work. Till next time.